Good morning. Thank you so much, Benneth and Housecall Providers, for having me here today. Again, my name is Barbara Smith-Warner, and I am a state representative from House District 45, which is Northeast Portland, Maywood Park, and Park Rose. I was appointed to the legislature last December to fill a vacancy when former Representative Dembro was appointed to the state senate, and then just in May won my own election outright. So I'm very much looking forward to going back to the legislature in the next 2-year cycle. Before that, however, I spent a number of years working with Senator Wyden as one of his field representatives in the state, and that is how I got to know about Housecall Providers. And thank you so much for all your kind words about Senator Wyden and the Independence at Home program. And I'm just here to confirm that it is indeed Housecall Providers was the inspiration for that program. Senator Wyden, as I'm sure you all know, has a long background in senior issues. He's had healthcare issues, and particularly the confluence of the two. He's always been very focused on things, on patient-centered care that makes sense and indeed can be a cost savings. And so when he met with Benneth and Housecall Providers, that was kind of the crystallization of a lot of his ideas about about a sustainable, long-range way to deal with Medicare costs. So he and Representative Markey introduced Independence at Home as a standalone bill in 2009, and then it ended up being wrapped into the Affordable Care Act and passed. And as Bennett said, it is now in the third year of that demonstration program. He is an extremely a great supporter of Housecall Providers and the project overall because of all the reasons we've already talked about, all the positive outcomes that are associated with a home-based, patient-based healthcare delivery model. It's interesting. I was looking through some of the notes on the webpage about the program, and I won't go through that again because you stole part of my presentation, I think, in your very good explanation of the program. But one thing I wanted to just read because it's so interesting, and it talked about that. One of the things that's such a great thing about the Independence at Home premise is it deals with what's commonly understood to be people's 3 greatest fears about aging, which is not being able to pay for your health care, a loss of independence, and becoming a burden to family and friends. And if you think about it, indeed, the Housecall Providers and what they do, that provision of care, really helps deal with those things that we all share. Everyone in this room, I think, would feel that same way. So now in my role as a state legislator, I am eager to do what I can to kind of spread the word about Housecall Providers in particular and home-based care in general, and to seek new opportunities for it to be utilized, whether it's through coordinated care organizations, the whole concept of wraparound care. I love that you talked about working with the people with the housing providers, because it's all, Governor Kitzhaber tells the story about the $80 air conditioner that that the idea of coordinated care is being able to spend $80 on an air conditioner for an elderly woman who lives in an apartment without air conditioning, and that $80 air conditioner will keep her from 3 to 5 hospital visits over the course of the summer because she has congestive heart failure, and the ability to keep her temperature down is going to make this small investment has huge dividends. So I am eager to seek at every level where else and how else can we implement this model to become the default model for care as much as we can at the state level, at the county level, all across the spectrum, and to continue to have Oregon lead the way and promote that as much as we can. And then I will close with a personal story as well, which is that I have a brother who has MS, who is homebound and has been for a number of years. He is lucky and very happy that he continues to live at home despite the progression of his disease over many years. And it's one of the many, he lives in Pennsylvania. It's one of the many reasons that I'm often encouraging he and his wife to try to move to Oregon, because there's so many great things here like this. And I think about, he recently went through a period where when he has to get care, he has some visiting nurses, but there is not this kind of a coordinated program that can provide him with that care. And so he still has to go to the doctor, go to the hospital. He had some bed sore issues recently where he ended up being hospitalized for 2 weeks. And he hates it. He hates to be there. He worries the whole time when he's there that he's going to get worse infections, and he's uncomfortable, it's unpleasant, and so I look forward to the day when he won't have to do that anymore, and anyone who has that situation, so that we really can keep focused on that patient care centered model that Housecall Providers provides. Thank you.